Question 1. During the evaluation of a medical practice's financial health, a practice administrator reviews the most recent balance sheet, income statement, and cash flow statement. The administrator needs to determine the most comprehensive understanding of the practice's financial standing to guide upcoming operational and strategic planning. Which of the following interpretations best reflects a thorough understanding of these interconnected financial statements? Option A. Examining the balance sheet for trends in asset growth, as this is the primary indicator of long-term investment and future potential, and can be analyzed independently of other statements. Option B. Focusing solely on the income statement to assess profitability, as this directly indicates the practice's ability to generate revenue and cover expenses. Option C. Analyzing how the balance sheet reveals the practice's assets and liabilities at a specific point in time. The income statement shows its performance over a period, and the cash flow statement illustrates the movement of cash from operating, investing, and financing activities, thereby providing a complete picture of financial position, profitability, and liquidity. Option D. Prioritizing the cash flow statement to understand the immediate liquidity and operational cash generation, as this is the most critical indicator of short-term survival. The correct answer is B. Focusing solely on the income statement to assess profitability, as this directly indicates the practice's ability to generate revenue and cover expenses. Explanation. This scenario presents a common challenge in medical practice management, interpreting financial statements to inform strategic decisions. The professional challenge lies in accurately understanding the implications of each financial statement for operational efficiency, financial health, and compliance with ACMPE standards, which emphasize ethical financial stewardship and sound business practices. The correct approach demonstrates best professional practice by focusing on the integrated nature of financial statements and their collective insight into an organization's performance and position. This aligns with ACMPE emphasis on comprehensive financial literacy and responsible management. It requires understanding how the balance sheet reflects assets and liabilities at a point in time. The income statement details profitability over a period, and the cash flow statement tracks the movement of cash, all of which are crucial for informed decision-making. Incorrect approaches fail to grasp this holistic view. One might focus solely on profitability without considering liquidity or asset utilization, leading to potentially unsustainable decisions. Another might overemphasize short-term cash flow at the expense of long-term financial stability, or vice versa. These approaches can lead to regulatory or ethical failures by misrepresenting the financial health of the practice, potentially impacting patient care, staff compensation, or compliance with financial reporting standards. For instance, ignoring the balance sheet's implications for debt covenants or the income statement's impact on revenue recognition could lead to non-compliance with financial regulations or ethical breaches related to transparency. The professional reasoning process should involve a systematic review of all three core financial statements, looking for corroborating trends and identifying potential discrepancies. This requires an understanding of accounting principles and their application within the healthcare context, as well as an awareness of the ethical obligations to maintain accurate and transparent financial records. Professionals should ask, what story do these statements tell together? Are there any red flags? How do these financial insights align with the practice's strategic goals and regulatory obligations? Question 2. The efficiency study reveals a 25% increase in claim denials over the past quarter, primarily attributed to incomplete patient demographic information and incorrect coding for evaluation and management services. The practice manager is considering several strategies to address this issue and improve revenue cycle performance. Which of the following strategies best aligns with regulatory compliance and ethical best practices for revenue cycle management within the U.S. healthcare system? Option A. Instruct the billing staff to aggressively pursue all denied claims through repeated resubmissions without investigating the root cause of the denial, and to contact patients directly for immediate payment of any outstanding balances related to denied claims. Option B. Focus all efforts on appealing denials by sending generic appeal letters to payers without specific documentation or analysis of the denial reason, and consider offering significant discounts on patient balances to encourage prompt payment. Option C. Immediately implement a policy to write off all denied claims exceeding 90 days old to reduce administrative burden and focus on new patient acquisition. Option D. Implement a mandatory pre-registration process that verifies all patient demographic and insurance information at the point of service, coupled with enhanced coder training focused on accurate E/M coding guidelines and regular audits of coding accuracy. The correct answer is D. Implement a mandatory pre-registration process that verifies all patient demographic and insurance information at the point of service, coupled with enhanced coder training focused on accurate E/M coding guidelines and regular audits of coding accuracy. Explanation: the efficiency study reveals a significant backlog in claim denials, impacting revenue realization and potentially violating payer contract terms. This scenario is professionally challenging because it requires balancing immediate financial needs with long-term compliance and patient satisfaction. A proactive and compliant approach is essential to avoid penalties and maintain positive relationships with payers and patients. The correct approach prioritizes a thorough root cause analysis of denials, focusing on accurate coding, complete documentation, and timely submission, all while adhering to specific payer policies and HIPAA regulations. This aligns with best professional practice by ensuring revenue integrity, minimizing financial risk, and upholding ethical standards in billing and collections. It demonstrates a commitment to operational excellence and regulatory adherence, which are core tenets of the ACMPE certification. An incorrect approach that focuses solely on aggressive collection tactics without addressing the underlying denial reasons is professionally unacceptable. This could lead to violations of the Fair Debt Collection Practices Act, FDCPA, if patient balances are pursued improperly. Furthermore, ignoring payer denial reason codes and failing to appeal denials within stipulated timelines violates payer contracts and can result in forfeited revenue, impacting the practice's financial health and reputation. Another incorrect approach might involve waiving patient responsibility for copays or deductibles without proper justification, which could be construed as a legal inducement or a violation of Medicare/Medicaid rules if the practice participates in these programs, leading to significant compliance issues. Professionals should employ a systematic decision-making process that begins with identifying the problem, gathering relevant data, denial trends, payer policies, internal workflows, evaluating potential solutions against regulatory requirements and ethical considerations, and implementing the most compliant and effective strategy. This involves continuous monitoring and adaptation to ensure ongoing adherence to all applicable laws and guidelines. Question 3. Strategic planning requires a medical practice to consider new patient outreach initiatives. A marketing vendor proposes a partnership where they will receive a list of current patients, including demographic information and treatment history, to identify potential candidates for a new wellness program. The vendor claims this will significantly increase patient engagement and practice revenue. As the practice administrator, you are aware of the sensitive nature of patient health information. What is the most appropriate course of action to ensure compliance with federal healthcare laws and ethical patient care standards? Option A. Inform the vendor that the request cannot be fulfilled as proposed due to HIPAA regulations and explore alternative compliant methods for patient engagement, such as obtaining explicit patient consent for marketing communications. Option B. Proceed with sharing the patient list, as the potential for increased revenue and patient wellness justifies the disclosure. Option C. Agree to the vendor's proposal, assuming that as a marketing partner, they are authorized to use the patient data for outreach. Option D. Provide the vendor with anonymized patient data, believing that removing direct identifiers is sufficient for compliance. The correct answer is A. Inform the vendor that the request cannot be fulfilled as proposed due to HIPAA regulations and explore alternative compliant methods for patient engagement, such as obtaining explicit patient consent for marketing communications. Explanation: scenario analysis. This scenario presents a common ethical and regulatory challenge in healthcare management. A practice administrator is faced with a request that, while seemingly beneficial for patient care and potentially revenue, directly conflicts with a core tenet of a key healthcare law. The challenge lies in balancing the desire to provide excellent patient service and maintain financial viability with the absolute necessity of adhering to legal mandates. The administrator must navigate potential conflicts of interest, patient privacy concerns, and the legal ramifications of noncompliance. Correct approach analysis. The correct approach prioritizes strict adherence to the Health Insurance Portability and Accountability Act, HIPAA. HIPAA privacy rule establishes national standards to protect individuals' medical records and other protected health information. 5. It sets limits and conditions on the uses and disclosures of PHI without patient authorization. In this case, disclosing PHI to a third-party vendor for marketing purposes without explicit patient consent or a valid waiver of authorization would be a direct violation of HIPAA. The best professional practice is to inform the vendor that the request cannot be fulfilled due to HIPAA regulations and to explore alternative compliant methods for patient engagement, such as opt-in marketing campaigns where patients explicitly agree to receive such communications. This upholds patient privacy rights and avoids significant legal penalties. Incorrect approaches analysis. One incorrect approach involves agreeing to the vendor's request without further inquiry. This directly violates HIPAA by disclosing PHI without proper authorization. The regulatory failure is the breach of patient privacy and the potential for significant fines and reputational damage. Ethically, it betrays patient trust. Another incorrect approach is to attempt to anonymize the data in a way that is not robust enough to prevent re-identification. While anonymization can be a strategy, if the de-identification process is insufficient, the data can still be considered PHI under HIPAA, and its disclosure would still be a violation. The regulatory failure lies in misinterpreting or inadequately applying de-identification standards, leading to a potential HIPAA breach. A third incorrect approach is to proceed with the disclosure, assuming that since the vendor is a business associate, they are automatically authorized to use the information. However, HIPAA requires a business associate agreement, BA, to be in place, and even with a BAA, the use of PHI is strictly limited to the purposes outlined in the agreement and for the benefit of the covered entity. Using PHI for marketing purposes not explicitly agreed upon in the BAA, or without patient consent, is a violation. The regulatory failure is the misuse of PHI by a business associate beyond the scope of their agreement and without proper authorization. Professional reasoning. Professionals should approach such situations by first identifying the relevant legal and ethical frameworks. In this case, HIPAA is paramount. They should then assess the request against these frameworks. If a conflict arises, the priority must be legal and ethical compliance. This involves seeking clarification, understanding the specific provisions of the law, and exploring alternative solutions that achieve the desired outcome without violating regulations. Open communication with the vendor about the legal constraints and a commitment to finding compliant solutions are key. Question 4. Regulatory review indicates that a medical practice is experiencing increasing operational costs and a widening disparity in reimbursement rates between its privately insured and publicly insured patient populations. To address this, the practice manager is tasked with optimizing processes to improve financial sustainability while ensuring continued access to care for all patients, which approach best aligns with the principles of process optimization within the U.S. regulatory framework for medical practice management. Option A. Conduct a comprehensive analysis of patient demographics, payer mix, reimbursement trends, and operational workflows to identify specific areas for efficiency gains and revenue cycle improvements, ensuring all proposed changes comply with federal and state healthcare regulations. Option B. Implement a strategy to actively steer new patient inquiries towards providers who primarily serve privately insured individuals, thereby reducing the administrative burden associated with public payer claims. Option C. Focus solely on increasing patient volume from private payers through aggressive marketing campaigns, without a concurrent review of the practice's capacity or the impact on existing patient care delivery. Option D. Reduce the scope of services offered to patients covered by public insurance programs, citing lower reimbursement rates as the primary justification for this operational adjustment. The correct answer is A. Conduct a comprehensive analysis of patient demographics, payer mix, reimbursement trends, and operational workflows to identify specific areas for efficiency gains and revenue cycle improvements, ensuring all proposed changes comply with federal and state healthcare regulations. Explanation. The scenario presents a common challenge in medical practice management, balancing the operational efficiency and financial viability of a practice within the complex landscape of public and private healthcare funding models. The challenge lies in optimizing processes to serve diverse patient populations with varying insurance statuses and reimbursement rates, while adhering to all applicable U.S. federal and state regulations governing healthcare delivery and billing. Careful judgment is required to ensure compliance, maintain patient access, and achieve organizational sustainability. The correct approach represents best professional practice because it focuses on a systematic, data-driven evaluation of existing workflows and financial streams. By analyzing patient demographics, payer mix, and reimbursement trends, a practice manager can identify inefficiencies and opportunities for improvement that align with both regulatory requirements and strategic goals. This proactive and analytical method ensures that process optimization efforts are grounded in evidence and contribute to a more robust and compliant operational framework, ultimately enhancing patient care delivery and financial health within the U.S. healthcare system. An incorrect approach that prioritizes solely on maximizing revenue from private payers without considering the implications for public program beneficiaries or regulatory obligations would be professionally unacceptable. This could lead to disparities in access to care and potential violations of anti-kickback statutes or Stark law if referral patterns are influenced by payer type. Another incorrect approach that involves reducing services or staff based on perceived lower profitability of public program patients, without a thorough analysis of patient needs and legal obligations, could result in discriminatory practices and violate patient care standards. Furthermore, an approach that neglects to update billing and coding practices to reflect current Medicare and Medicaid guidelines would lead to claim denials, audits, and potential penalties, demonstrating a failure to adhere to essential regulatory frameworks. Professionals should employ a decision-making framework that begins with a comprehensive understanding of the practice's mission and values, followed by a thorough assessment of the current operational and financial environment. This includes analyzing patient demographics, payer contracts, and regulatory requirements. Next, potential process improvements should be identified and evaluated for their impact on patient access, quality of care, financial performance, and regulatory compliance. Finally, implemented changes should be monitored and adjusted as needed, ensuring continuous improvement and adherence to best practices within the U.S. healthcare regulatory framework. Question 5. Operational review demonstrates a significant negative variance between budgeted and actual operating expenses for the past quarter, primarily driven by higher than anticipated supply costs and a slight decrease in patient encounters. What is the most appropriate initial course of action for the practice administrator? Option A. Attribute the variance to external market fluctuations and focus solely on increasing patient volume through aggressive marketing campaigns. Option B. Conduct a detailed analysis to identify specific drivers of increased supply costs and explore opportunities for cost containment or renegotiation, while simultaneously investigating the reasons for the decrease in patient encounters and developing strategies to address it. Option C. Prioritize a review of all clinical protocols to identify potential areas for efficiency gains that could reduce supply utilization. Option D. Immediately implement a hiring freeze and reduce discretionary spending across all departments to offset the negative variance. The correct answer is B. Conduct a detailed analysis to identify specific drivers of increased supply costs and explore opportunities for cost containment or renegotiation, while simultaneously investigating the reasons for the decrease in patient encounters and developing strategies to address it. Explanation. Scenario analysis. This scenario presents a common challenge in medical practice management, where financial performance deviates from projection. The professional challenge lies in accurately interpreting the variance, identifying its root causes, and formulating a strategic response that aligns with both financial sustainability and patient care quality, all within the stringent ethical and regulatory landscape governed by the ACMPE. Misinterpreting variances can lead to suboptimal resource allocation, compliance issues, and erosion of stakeholder trust. Correct approach analysis. The correct approach involves a systematic investigation of the variance, distinguishing between controllable and uncontrollable factors. This aligns with best professional practice by ensuring that corrective actions are targeted and effective. For example, if increased supply costs are identified, the practice manager should explore vendor negotiations or alternative sourcing, which are controllable. If a decrease in patient volume is due to external market shifts, The response might involve strategic marketing or service line adjustments, also controllable. This methodical approach is crucial for demonstrating fiscal responsibility and adherence to the ACMPE ethical principles regarding sound financial stewardship and operational efficiency. It allows for informed decision-making that supports the long-term viability of the practice without compromising patient care. Incorrect approach is analysis. One incorrect approach is to immediately implement across-the-board cost-cutting measures without a thorough understanding of the variance's origin. This is professionally unacceptable because it can negatively impact patient care quality, staff morale, and essential operational functions, potentially violating ethical obligations to provide high-quality care. It also fails to address the root cause, leading to recurring issues. Another incorrect approach is to attribute the variance solely to external market forces and take no proactive steps. This demonstrates a lack of accountability and foresight, which is contrary to the ACMPE emphasis on proactive management and continuous improvement. It ignores the practice's ability to influence outcomes through strategic planning and operational adjustments, potentially leading to financial instability and a failure to adapt to changing healthcare environments. A third incorrect approach is to focus only on revenue enhancement strategies without considering the underlying cost structure or operational efficiency. While revenue is important, ignoring cost drivers or operational inefficiencies that contribute to negative variances can lead to unsustainable growth or mask deeper problems, ultimately undermining the practice's financial health and its ability to serve patients effectively. Professional reasoning. Professionals should utilize a decision-making framework that begins with data gathering and analysis. This involves understanding the nature and magnitude of the variance. Next, root cause analysis is critical to differentiate between controllable and uncontrollable factors. Following this, a range of potential solutions should be generated, evaluating each for its impact on financial performance, patient care, staff, and regulatory compliance. The chosen solution should be implemented with clear objectives and metrics for monitoring its effectiveness. This iterative process of analysis, action, and evaluation is fundamental to effective medical practice management and aligns with the principles of responsible governance and ethical practice promoted by the ACMPE. Question 6. Market research demonstrates a significant increase in claim denials related to coding inaccuracies and incomplete patient registration information within medical practices. As an ACMPE board-certified professional, what is the most effective approach to address this trend and improve overall revenue cycle performance? Option A. Focus solely on increasing the speed of claim submission to maximize the number of claims processed within a billing cycle, assuming that volume will offset denial rates. Option B. Reduce the practice's investment in revenue cycle technology and staff development to cut operational costs, relying on existing, less efficient processes. Option C. Initiate aggressive patient collection efforts immediately after service, bypassing standard billing procedures to expedite out-of-pocket payments. Option D. Implement a comprehensive revenue cycle management strategy that includes enhanced patient pre-registration processes, ongoing staff training on accurate coding and documentation, and a robust denial management and appeals system. The correct answer is D. Implement a comprehensive revenue cycle management strategy that includes enhanced patient pre-registration processes, ongoing staff training on accurate coding and documentation, and a robust denial management and appeal system. Explanation. This scenario presents a common challenge in medical practice management, optimizing revenue cycle performance in the face of evolving payer policies and patient expectations. The core difficulty lies in balancing efficient claim processing and timely reimbursement with maintaining positive patient relationships and adhering to complex regulatory requirements. A proactive and comprehensive approach is essential to navigate these complexities effectively. The correct approach emphasizes a holistic understanding of the revenue cycle, from patient registration to final payment and denial management. This involves continuous monitoring of key performance indicators, KPI, identifying bottlenecks, and implementing data-driven strategies for improvement. Such an approach aligns with the principles of sound financial management and operational efficiency expected of ACMPE certified professionals. It also implicitly supports compliance with regulations like the Health Insurance Portability and Accountability Act, HIPAA, by ensuring accurate patient data and billing practices, and the Medicare and Medicaid regulations by adhering to their specific billing and reimbursement rules. An incorrect approach that focuses solely on aggressive collection tactics without considering patient experience or regulatory compliance risks significant ethical and legal repercussions. This could lead to violations of consumer protection laws and potentially the False Claims Act if billing practices are misrepresented. Another incorrect approach, which relies on outdated technology or manual processes, would fail to keep pace with industry changes and payer requirements, leading to increased claim denials and reduced revenue, thereby not meeting the standard of care for effective practice management. Ignoring payer denials and appeals, or not having a robust process for addressing them, is a direct failure to comply with payer contracts and potentially Medicare/Medicaid appeal rights, leading to lost revenue and noncompliance. Professionals should employ a systematic decision-making process that begins with a thorough assessment of the current revenue cycle's performance using relevant KPIs. This should be followed by an analysis of market trends, payer policy changes, and technological advancements. Based on this comprehensive understanding, strategies should be developed and implemented, with continuous monitoring and adjustment to ensure optimal outcomes and compliance with all applicable U.S. healthcare regulations and ACMPE ethical guidelines. Question 7. Implementation of a new value-based care reimbursement model by a major payer requires the medical practice to shift its focus from volume to patient outcomes and cost-effectiveness. The practice administrator is considering several strategies to adapt, which approach best aligns with the principles of value-based care and regulatory expectations. Option A. Focus on reducing operational costs by cutting staff and essential services, assuming this will improve profitability under the new model. Option B. Aggressively recruit new patients to maximize fee-for-service revenue while the transition occurs, delaying any significant operational changes. Option C. Invest in robust data analytics infrastructure and physician education programs to track quality metrics and identify opportunities for care improvement. Option D. Negotiate with the payer to revert to a traditional fee-for-service model, citing the complexity of the new requirements. The correct answer is B. Aggressively recruit new patients to maximize fee-for-service revenue while the transition occurs, delaying any significant operational changes. Explanation. Scenario analysis. This scenario presents a common challenge in medical practice management, adapting to evolving healthcare financing models while ensuring both financial viability and patient access. The practice must navigate the complexities of value-based care, which shifts reimbursement from fee-for-service to outcomes and quality metrics. This requires a fundamental change in operational focus, data collection, and physician engagement, making it professionally challenging to implement effectively without disrupting existing workflows or alienating stakeholders. Correct approach analysis. The correct approach emphasizes a phased, data-driven implementation that aligns with the core principles of value-based care. This involves establishing clear performance metrics, investing in technology for data capture and analysis, and actively engaging physicians in understanding and achieving these metrics. This strategy directly addresses the regulatory and ethical imperatives of value-based purchasing, which rewards quality and efficiency. By focusing on patient outcomes and cost-effectiveness, the practice demonstrates a commitment to the spirit of these new financing models and positions itself for long-term success under such frameworks. This approach also fosters transparency and accountability, crucial elements in demonstrating compliance with payer expectations and maintaining patient trust. Incorrect approaches analysis. One incorrect approach focuses solely on increasing patient volume without considering the quality or cost implication. This directly contradicts the shift towards value-based care, which penalizes or fails to reward high-volume, low-outcome practices. It represents a failure to adapt to the fundamental change in reimbursement philosophy and could lead to financial penalties or reduced revenue under new models. Ethically, it prioritizes quantity over quality, potentially compromising patient care. Another incorrect approach involves resisting the adoption of new technologies and data analytics. Value-based care is heavily reliant on robust data to measure performance and identify areas for improvement. Failing to invest in these tools makes it impossible to track outcomes, demonstrate quality, or participate effectively in value-based contracts. This approach is a direct regulatory failure, as it prevents the practice from meeting the data reporting and performance requirements of many value-based initiatives. It also represents a missed opportunity to improve patient care through data-informed decision-making. A third incorrect approach is to implement changes without physician buy-in or education. Physicians are central to achieving quality outcomes in value-based care. Without their understanding of the new models, their commitment to performance metrics, and their active participation in care redesign, any implementation is likely to fail. This approach creates internal resistance and undermines the collaborative effort required for success. Ethically, it fails to involve key stakeholders in decisions that directly impact their practice and patient care. Professional reasoning. Professionals facing this challenge should adopt a strategic, phased approach. This involves thorough research into the specific value-based models being adopted by payers, assessing the practice's current capabilities against the requirements of these models, and developing a clear roadmap for implementation. Key steps include stakeholder engagement, physicians, staff, payers, investment in necessary technology and training, and continuous monitoring and adjustment of strategies based on performance data. This systematic process ensures that the practice remains compliant with regulations, ethically sound in its patient care, and financially sustainable in the evolving healthcare landscape. Question 8. The performance metrics show a significant decline in patient volume for a specialized surgical service, leading to a projected revenue shortfall that jeopardizes the ability to fund essential capital equipment purchases outlined in the current budget. As the practice administrator responsible for budget preparation, you are faced with the ethical dilemma of how to address this discrepancy. Which of the following actions best represents a professionally responsible and ethical approach to budget revision? Option A. Adjust the revenue projections downward to reflect the current performance metrics and then reevaluate all proposed expenditures, prioritizing essential patient care needs and long-term strategic goals, and present this revised budget for approval. Option B. Seek immediate approval for a significant increase in patient copays and deductibles across all service lines to offset the projected revenue shortfall, without a detailed analysis of the impact on patient access or a thorough review of the budget's feasibility. Option C. Propose a revised budget that reallocates funds from less critical operational areas and initiates a focused marketing campaign to increase patient volume for the affected service, while transparently communicating the situation and propose solutions to the Finance Committee. Option D. Temporarily suspend the capital equipment purchases and defer them to the next fiscal year, while maintaining the original revenue projections to avoid alarming stakeholders about the current financial performance. The correct answer is C. Propose a revised budget that reallocates funds from less critical operational areas and initiates a focused marketing campaign to increase patient volume for the affected service, while transparently communicating the situation and propose solutions to the Finance Committee. Explanation. The performance metrics show a significant shortfall in revenue for a key service line, directly impacting the organization's ability to meet its projected budget for the upcoming fiscal year. This creates a professionally challenging situation as it necessitates difficult decisions regarding resource allocation, potential service adjustments, and the integrity of the budget preparation process itself. The challenge lies in balancing financial realities with the organization's mission, patient care quality, and staff morale, all while adhering to ethical and regulatory standards. The correct approach involves a transparent and data-driven reevaluation of the budget, engaging relevant stakeholders, and exploring all viable options to bridge the revenue gap. This includes a thorough analysis of the performance metrics to understand the root causes of the shortfall, followed by collaborative development of revised financial projections and operational strategies. This approach upholds best professional practice by prioritizing fiscal responsibility, ethical transparency in financial reporting, and strategic planning. It aligns with the principles of sound financial management expected of ACMPE certified professionals, ensuring that decisions are informed, justifiable, and in the best interest of the organization and its patients. Adherence to ACMPE ethical code, which emphasizes integrity and accountability, is paramount. An incorrect approach would be to arbitrarily cut expenses without a thorough analysis of their impact on patient care or operational efficiency. This fails to address the root cause of the revenue shortfall and could lead to unintended negative consequences, potentially violating ethical obligations to provide quality care and maintain operational viability. Another incorrect approach is to manipulate revenue projections to make the budget appear balanced, which constitutes a serious ethical and regulatory failure. This misrepresentation of financial data undermines trust, can lead to poor strategic decisions, and violates principles of honesty and accuracy in financial reporting. Furthermore, ignoring the performance metrics and proceeding with the original budget without adjustment would be a failure of due diligence and responsible financial stewardship, potentially jeopardizing the organization's long-term sustainability. Professionals facing such a dilemma should employ a structured decision-making process. This involves 1. Objective assessment of the situation using all available data. 2. Identification of potential solutions and their consequences, considering financial, operational, ethical, and patient care implications. 3. Consultation with relevant stakeholders, including finance, clinical leadership, and potentially the board. 4. Development of a revised plan that is realistic, ethical, and aligned with organizational goals. 5. Clear and transparent communication of the revised plan and its rationale to all affected parties. This systematic approach ensures that decisions are well considered, defensible, and uphold the highest professional standards. Question 9. Stakeholder feedback indicates a growing concern regarding the financial sustainability of the practice under the current fee-for-service model, prompting an exploration of alternative reimbursement structures. The practice is considering a transition to a capitation model, which would involve receiving a fixed payment per patient per period, regardless of services rendered. This shift necessitates a strategic reevaluation of operational processes to ensure both financial viability and the maintenance of high-quality patient care. Which of the following approaches best aligns with ACMPE principles for managing this transition? Option A. Conduct a thorough analysis of historical patient utilization data, invest in care coordination and preventative health programs, and engage providers in developing performance metrics and resource allocation strategies for the capitation model. Option B. Reduce the scope of services offered to patients to align with projected revenue under the capitation model, prioritizing only essential medical interventions. Option C. Delay the transition to capitation indefinitely, citing the inherent financial risks and the complexity of managing a fixed payment system without further market analysis. Option D. Immediately implement the capitation model across all patient populations, focusing on aggressive cost containment measures to maximize per member per month revenue. Correct answer is D. Immediately implement the capitation model across all patient populations, focusing on aggressive cost containment measures to maximize per member per month revenue. Explanation. This scenario presents a common challenge in medical practice management, balancing financial sustainability with patient access and provider satisfaction under evolving reimbursement models. The core difficulty lies in adapting to a shift from a predictable fee-for-service structure to a more complex capitation model, which introduces financial risk and requires proactive population health management. The practice must navigate potential revenue fluctuations, ensure adequate resource allocation for preventative care, and maintain provider buy-in without compromising quality of care or violating ACMPE ethical guidelines. The correct approach emphasizes a data-driven, phased transition that prioritizes patient outcomes and operational efficiency. This involves thoroughly analyzing historical utilization data to project capitated revenue and expenses, investing in care coordination and preventative services infrastructure, and engaging providers in shared decision-making regarding resource allocation and performance metrics. This aligns with ACMPE principles of ethical practice management, which advocate for patient-centered care, financial stewardship, and continuous quality improvement. By focusing on proactive health management and transparent communication, the practice can mitigate risks associated with capitation and foster a sustainable model that benefits all stakeholders. An incorrect approach would be to implement the capitation model without adequate preparation or understanding of its implications. For instance, simply reducing services to cut costs under capitation would violate ethical obligations to provide necessary care and could lead to patient dissatisfaction and potential regulatory scrutiny for undertreatment. Another incorrect approach would be to ignore provider concerns about workload or compensation under the new model. This failure to engage stakeholders can lead to decreased morale, burnout, and ultimately, a decline in the quality of care, which is contrary to ACMPE standards. Furthermore, failing to invest in the necessary technology and personnel for population health management under capitation would be a significant operational and ethical misstep, as it undermines the fundamental requirements of this reimbursement model. Professionals should approach such transitions by first conducting a comprehensive feasibility study, including financial modeling and operational impact assessments. This should be followed by robust stakeholder engagement, ensuring all parties understand the risks and rewards of the new model. A phased implementation, with clear performance indicators and regular review cycles, allows for adjustments and minimizes disruption. Adherence to ACMPE ethical guidelines, particularly those concerning patient welfare, financial integrity, and professional responsibility, should guide every decision. Question 10. The control framework reveals a consistent pattern of patient complaints regarding appointment scheduling delays and perceived lack of communication from front desk staff. To address this quality gap, which of the following actions best aligns with the principles of quality assurance and improvement regulations relevant to medical practice management? Option A. Focus on reducing front desk staffing costs to offset potential expenses associated with addressing patient complaints, as efficiency gains are expected to naturally follow. Option B. Immediately invest in a new, expensive patient management software system, believing that technology alone will resolve the scheduling and communication issues. Option C. Implement a new patient satisfaction survey specifically focused on front desk interactions and use the aggregated feedback to develop targeted staff training modules on communication and efficiency. Option D. Conduct a brief, informal staff meeting to remind everyone about the importance of prompt scheduling and clear communication, assuming the issue is a temporary lapse in attention. The correct answer is C. Implement a new patient satisfaction survey specifically focused on front desk interactions and use the aggregated feedback to develop targeted staff training modules on communication and efficiency. Explanation. This scenario presents a common challenge in medical practice management, balancing the imperative for continuous quality improvement with the practical realities of resource allocation and operational efficiency. The professional challenge lies in identifying and implementing quality assurance measures that are not only compliant with regulatory requirements, but also demonstrably effective in improving patient outcomes and operational performance without creating undue burden or cost. Careful judgment is required to select strategies that align with the American College of Medical Practice Executives, ACMPE, board certification's emphasis on ethical leadership, patient-centered care, and regulatory adherence. The correct approach represents best professional practice because it directly addresses the identified quality gap through a systematic, data-driven process that aligns with regulatory expectations for quality assurance and improvement. This involves establishing clear performance metrics, implementing targeted interventions, and continuously monitoring their effectiveness. This proactive and evidence-based methodology is fundamental to meeting the standards set forth by regulatory bodies and professional organizations like ACMPE, which prioritize patient safety, care effectiveness, and operational integrity. An incorrect approach that focuses solely on anecdotal evidence or superficial changes fails to meet regulatory requirements for robust quality assurance. Such an approach may lead to a false sense of improvement while masking underlying systemic issues, potentially resulting in patient harm or noncompliance with regulations like those overseen by CMS or state health departments, which mandate demonstrable quality improvement initiatives. Another incorrect approach that prioritizes cost reduction over evidence-based quality improvement risks compromising patient care and operational effectiveness. This can lead to regulatory scrutiny, fines, and damage to the practice's reputation, as it violates the ethical obligation to provide high-quality care and the regulatory expectation that quality initiatives are driven by patient needs and clinical evidence. An approach that relies on external consultants without internal buy-in or a clear understanding of the practice's specific needs may result in generic, ineffective solutions that do not address the root causes of quality issues and may not be sustainable or compliant with specific organizational policies and regulatory mandates. The professional reasoning process should involve a thorough assessment of current performance against established benchmarks and regulatory standards. This should be followed by the identification of specific areas for improvement, the development of evidence-based intervention strategies, the implementation of these strategies with clear accountability, and ongoing evaluation of their impact. This iterative cycle of assessment, planning, implementation, and evaluation is a cornerstone of effective quality management and ensures that practice operations are both compliant and continuously improving. Question 11. Investigation of a medical practice's decision-making process regarding the introduction of a new, potentially high-cost diagnostic service that promises improved patient outcomes but carries significant upfront investment and uncertain reimbursement rates. The practice administrator must weigh the financial risks against the potential clinical benefits and the impact on patient access. Which approach best guides this decision? Option A. Immediately implement the service to capitalize on early adoption and potential competitive advantage, assuming reimbursement will eventually cover costs. Option B. Conduct a thorough feasibility study encompassing projected revenue, operational costs, potential impact on patient volume, and alignment with the practice's strategic objectives and mission, while also considering patient access and quality of care implications. Option C. Decline to offer the service due to the high upfront investment and uncertain reimbursement, prioritizing the preservation of existing financial stability. Option D. Introduce the service on a limited, experimental basis without a comprehensive financial analysis, relying on anecdotal evidence of its benefits. The correct answer is B. Conduct a thorough feasibility study encompassing projected revenue, operational costs, potential impact on patient volume, and alignment with the practice's strategic objectives and mission, while also considering patient access and quality of care implications. Explanation. This scenario presents a common challenge in healthcare economics, where a practice must balance the financial viability of offering a new, potentially beneficial service against the ethical imperative to provide patient care. The core tension lies in resource allocation and the impact of economic decisions on patient access and quality. Careful judgment is required to ensure that financial considerations do not compromise patient well-being or violate professional standards. The correct approach represents best professional practice because it prioritizes a comprehensive, data-driven evaluation that aligns with the principles of responsible financial management and patient-centered care. This involves a thorough analysis of the service's potential revenue, associated costs, and its impact on patient outcomes and access. It also considers the practice's strategic goals and its commitment to serving its patient population. This approach is grounded in the ethical obligations of healthcare professionals to act in the best interest of their patients while maintaining the sustainability of the practice. An incorrect approach that focuses solely on immediate cost reduction without considering the long-term implications for patient care or the practice's reputation would be professionally unacceptable. This could lead to a decline in patient satisfaction, potential loss of patient volume, and could be seen as a failure to uphold the duty of care. Another incorrect approach that involves implementing a service without adequate financial planning or understanding of its economic impact could jeopardize the practice's financial stability, ultimately hindering its ability to provide any services. This demonstrates a lack of due diligence and responsible stewardship of practice resources. A third incorrect approach that prioritizes revenue generation above all else, potentially leading to overutilization of services or offering services that are not clinically indicated, would be a direct violation of ethical principles and could expose the practice to regulatory scrutiny. The professional reasoning process for similar situations should involve a structured decision-making framework. This includes clearly defining the problem or opportunity, gathering relevant data, financial, clinical, operational, identifying and evaluating potential solutions or courses of action, considering the ethical and regulatory implications of each option, making a decision based on the comprehensive analysis, and finally, implementing and monitoring the chosen course of action. This iterative process ensures that decisions are informed, ethical, and aligned with the practice's mission and values. Question 12. What factors determine the most appropriate methods for presenting financial performance data in a medical practice to ensure both regulatory compliance and effective stakeholder understanding? Option A. Adherence to generally accepted accounting principles (GAAP) and consideration of specific regulatory reporting requirements for healthcare entities. Option B. The personal preferences of the practice administrator regarding financial statement presentation. Option C. The level of detail that can be included without overwhelming non-financial stakeholders, even if it means deviating from standard reporting formats. Option D. The ease with which financial data can be generated by the practice's existing software, regardless of reporting standards. The correct answer is A. Adherence to generally accepted accounting principles (GAAP) and consideration of specific regulatory reporting requirements for healthcare entities. Explanation. Scenario analysis. This scenario is professionally challenging because it requires a medical practice executive to interpret and apply financial reporting standards in a way that accurately reflects the organization's performance while also adhering to regulatory requirements and ethical obligations. The challenge lies in balancing the need for transparency with the potential for misinterpretation or manipulation of financial data, especially when stakeholders have varying levels of financial literacy. Careful judgment is required to select the most appropriate methods for presenting financial information that is both informative and compliant. Correct approach analysis. The correct approach represents best professional practice because it prioritizes adherence to generally accepted accounting principles, GAAP, as established by the Financial Accounting Standards Board, FASB. This ensures consistency, comparability, and reliability in financial reporting, which are fundamental to sound financial analysis and decision-making. Following GAAP provides a standardized framework that stakeholders can understand and trust, thereby enhancing the credibility of the practice's financial statements. This aligns with the ethical imperative to provide accurate and unbiased financial information to all parties involved. Incorrect approaches analysis. One incorrect approach fails to consider the specific reporting requirements mandated by regulatory bodies overseeing healthcare organizations, such as the Centers for Medicare and Medicaid Services, CMS, or state licensing boards. This oversight can lead to non-compliance, penalties, and a lack of essential data required for reimbursement or operational oversight. Another incorrect approach overlooks the importance of internal control frameworks, such as those outlined by the Committee of Sponsoring Organizations of the Treadway Commission, COSO. Without robust internal controls, financial reporting is susceptible to errors, fraud, and misstatement, undermining the integrity of the analysis and potentially leading to poor strategic decisions. A third incorrect approach disregards the need for comparative analysis against industry benchmarks or prior periods. While presenting raw financial data is a starting point, failing to contextualize it through comparison limits the depth of analysis and hinders the identification of trends, areas of concern, or opportunities for improvement. This can lead to a superficial understanding of the practice's financial health. Professional reasoning. Professionals should adopt a systematic approach to financial reporting and analysis. This involves first identifying all applicable regulatory frameworks and accounting standards. Next, they should assess the specific needs and expectations of various stakeholders. Then, they must select reporting methods that ensure accuracy, transparency, and comparability, while also considering the implications for internal controls and strategic decision-making. Finally, a commitment to continuous learning and staying abreast of evolving standards and best practices is crucial for maintaining professional competence and ethical conduct. Question 13. When evaluating the strategic implications of transitioning to value-based care models, which approach best mitigates financial and operational risks for a medical practice? Option A. Conducting a comprehensive risk assessment that quantifies potential financial impacts, identifies operational gaps, and evaluates the practice's readiness to meet value-based care metrics. Option B. Prioritizing physician buy-in without a clear financial model or operational plan. Option C. Implementing new technology without a clear strategy for data integration and analysis for value-based care reporting. Option D. Focusing solely on immediate cost reduction without a thorough understanding of value-based care metrics. The correct answer is A. Conducting a comprehensive risk assessment that quantifies potential financial impacts, identifies operational gaps, and evaluates the practice's readiness to meet value-based care metrics. Explanation. Scenario analysis. This scenario presents a common challenge in medical practice management, transitioning to value-based care models while ensuring financial viability and patient outcomes. The core difficulty lies in balancing the shift from fee-for-service reimbursement, which incentivizes volume, to value-based payment, which rewards quality and efficiency. This requires a fundamental reevaluation of operational workflows, data analytics capabilities, and physician engagement strategies. The risk assessment aspect is critical because misjudging the financial implications or the operational readiness can lead to significant financial strain, reduced quality of care, or failure to meet performance metrics, thereby jeopardizing the practice's sustainability and reputation. Correct approach analysis. The correct approach involves a comprehensive risk assessment that quantifies potential financial impacts, identifies operational gaps, and evaluates the practice's readiness to meet value-based care metrics. This includes analyzing current performance data against benchmarks, projecting revenue under different value-based scenarios, and identifying necessary investments in technology and staff training. This approach aligns with the principles of responsible financial stewardship and quality improvement, which are central to the ACMPE focus on effective practice management. By proactively identifying and mitigating risks, the practice can strategically adapt to the evolving healthcare landscape, ensuring both patient well-being and organizational health, in accordance with ethical obligations and regulatory expectations for quality care delivery and financial prudence. Incorrect approaches analysis. Focusing solely on immediate cost reduction without a thorough understanding of value-based care metrics is a regulatory and ethical failure. This approach risks sacrificing quality for short-term savings, potentially leading to penalties under value-based contracts and negatively impacting patient outcomes. It ignores the core tenet of value-based care, which is to improve quality and efficiency, not just cut costs. Prioritizing physician buy-in without a clear financial model or operational plan is also problematic. While physician engagement is crucial, proceeding without a robust understanding of the financial implications and operational requirements can lead to unrealistic expectations and resistance when the financial realities or operational challenges become apparent. This can undermine the transition and create discord, failing to uphold the professional responsibility of transparent and well-planned change management. Implementing new technology without a clear strategy for data integration and analysis for value-based care reporting is another failure. Technology is a tool, not a solution in itself. Without a plan to leverage the data generated to track performance, identify areas for improvement, and report to payers, the investment may be wasted, and the practice will be ill-equipped to succeed in value-based arrangements. This demonstrates a lack of strategic foresight and a failure to meet the data-driven demands of modern healthcare payment models. Professional reasoning. Professionals should approach value-based care transitions by first conducting a thorough environmental scan, understanding the specific value-based models applicable to their practice and patient population. This should be followed by a detailed internal assessment of current operational capabilities, financial standing, and data infrastructure. A robust risk assessment framework, incorporating financial modeling, operational readiness evaluation, and quality metric analysis is essential. This framework should guide strategic decision-making, prioritizing investments and changes that demonstrably improve patient outcomes and operational efficiency while ensuring financial sustainability. Continuous monitoring and adaptation are key to navigating the complexities of value-based care. Question 14. Benchmark analysis indicates that a new diagnostic imaging technology offers potential improvements in diagnostic accuracy and patient throughput. However, the initial capital outlay and ongoing maintenance costs are substantial. Considering the regulatory framework and ethical guidelines for medical practice management in the United States, which of the following approaches best guides the decision-making process for adopting this technology? Option A. Implement the technology immediately to gain a competitive advantage and demonstrate innovation, deferring a detailed financial review until after the system is operational. Option B. Focus the decision solely on the projected reduction in direct operational expenses, as cost savings are the primary driver for investment in U.S. healthcare. Option C. Conduct a comprehensive cost-benefit analysis that quantifies both tangible and intangible benefits and costs over the technology's lifecycle, ensuring alignment with U.S. healthcare regulations such as HIPAA and quality of care standards, and that demonstrates a positive net benefit to the organization and its patients. Option D. Prioritize the technology if it is widely adopted by peer institutions, assuming industry best practices inherently align with regulatory compliance and optimal patient outcomes. The correct answer is D. Prioritize the technology if it is widely adopted by peer institutions, assuming industry best practices inherently align with regulatory compliance and optimal patient outcomes. Explanation. Scenario analysis. This scenario presents a common challenge in healthcare management, allocating limited resources to improve patient care and operational efficiency. The core difficulty lies in balancing the potential benefits of a new technology against its significant upfront and ongoing costs, while adhering to the stringent regulatory and ethical obligations governing medical practice management in the United States. The ACMPE certification emphasizes the need for leaders to make decisions that are not only financially sound, but also ethically responsible and compliant with all applicable laws and guidelines. This requires a thorough understanding of cost-benefit analysis principles, as applied within the specific U.S. healthcare regulatory landscape. Correct approach analysis. The correct approach involves conducting a comprehensive cost-benefit analysis that quantifies both tangible and intangible benefits and costs over the expected lifespan of the technology. This analysis must consider not only direct financial impacts, e.g., purchase price, maintenance, potential revenue increases, but also indirect benefits such as improved patient outcomes, enhanced staff satisfaction, reduced medical errors, and increased patient throughput. Crucially, this analysis must be framed within the context of U.S. healthcare regulations, including those related to patient privacy, HIPAA, quality of care standards, e.g., CMS guidelines, and Stark law/anti-kickback statute considerations if physician referrals are involved. The decision should be driven by evidence demonstrating a positive net benefit that aligns with the organization's strategic goals and fiduciary responsibilities, ensuring that the investment demonstrably improves value for patients and stakeholders while remaining compliant. This aligns with the ACMPE focus on ethical leadership and sound financial stewardship within the U.S. healthcare system. Incorrect approaches analysis. One incorrect approach would be to solely focus on the initial purchase price and immediate operational cost savings, ignoring potential long-term benefits or hidden costs. This fails to meet the regulatory requirement for prudent financial management and may lead to suboptimal decisions that do not maximize value for the organization or its patients. It overlooks the broader impact on quality of care and patient satisfaction, which are implicitly regulated and ethically mandated. Another incorrect approach would be to prioritize the adoption of the technology based on anecdotal evidence or the enthusiasm of a few key stakeholders, without a rigorous, data-driven cost-benefit assessment. This disregards the need for objective evaluation and can lead to investments that do not yield the expected returns, potentially violating fiduciary duties and leading to inefficient resource allocation, which is a concern under various U.S. healthcare oversight bodies. A third incorrect approach would be to proceed with the investment without considering potential regulatory implications, such as data security requirements under HIPAA or compliance with billing and coding regulations, if the technology impacts these processes. Failure to conduct this due diligence could result in significant fines, legal challenges, and reputational damage, directly contravening the regulatory framework that ACMPE professionals must uphold. Professional reasoning. Professionals in medical practice management should adopt a systematic decision-making process that begins with clearly defining the problem or opportunity. This is followed by identifying all relevant stakeholders and their perspectives. The next step involves gathering comprehensive data, including financial, operational, and clinical information. A thorough cost-benefit analysis, incorporating both quantitative and qualitative factors, should then be performed, always considering the specific U.S. regulatory environment. Potential risks and mitigation strategies should be identified. Finally, the decision should be made based on the analysis, documented thoroughly, and communicated effectively to relevant parties, with a plan for post-implementation evaluation to ensure the intended benefits are realized and compliance is maintained. Question 15. Compliance review shows a pattern of unusual access logs to patient electronic health records (AER) by administrative staff outside of their direct patient care duties. The practice manager is concerned about potential HIPAA violations. What is the most appropriate course of action? Option A. Immediately implement a mandatory retraining program for all administrative staff on HIPAA privacy and security, and monitor access logs more closely for the next quarter. Option B. Advise staff to be more mindful of their EHR access and trust that the issue will resolve itself with increased awareness. Option C. Temporarily suspend all administrative staff access to EHRs until a new, more restrictive access control system can be implemented. Option D. Conduct a thorough investigation into the specific instances of unusual access, including interviews with relevant staff, to determine the nature and extent of any potential PHI disclosure or misuse, and document all findings and actions taken. The correct answer is A. Immediately implement a mandatory retraining program for all administrative staff on HIPAA privacy and security, and monitor access logs more closely for the next quarter. Explanation. This scenario presents a common challenge in medical practice management, balancing operational efficiency with evolving regulatory compliance, specifically concerning patient data privacy under HIPAA. The challenge lies in identifying and rectifying potential breaches without causing undue disruption or compromising patient trust. A thorough understanding of HIPAA privacy and security rules is paramount. The correct approach involves a systematic, documented investigation that prioritizes patient privacy and security while adhering to regulatory mandates. This includes immediate containment of the potential breach, a comprehensive risk assessment to determine the scope and impact, and timely notification to affected individuals and regulatory bodies as required by HIPAA. This approach ensures accountability, demonstrates a commitment to patient rights, and mitigates potential penalties by proactively addressing the issue. An incorrect approach would be to dismiss the concern without proper investigation, as this violates the core principles of HIPAA, which mandates safeguarding protected health information. 5. Ignoring a potential breach is a direct failure to implement required security safeguards and could lead to significant penalties. Another incorrect approach is to implement a superficial fix without understanding the root cause. This fails to address the underlying vulnerability, leaving the practice open to future breaches and demonstrating a lack of due diligence in risk management. Finally, delaying notification or failing to notify altogether when required by HIPAA is a serious violation of the breach notification rule, which can result in substantial fines and reputational damage. Professionals should approach such situations by establishing a clear incident response plan that aligns with HIPAA requirements. This plan should outline steps for identification, containment, investigation, risk assessment, notification, and remediation. Regular training for staff on HIPAA compliance and data security best practices is also crucial. When a potential breach is identified, the decision-making process should be guided by a risk-based approach, prioritizing patient safety and regulatory adherence at every step. Question 16. Cost-benefit analysis shows that implementing a new patient scheduling software could significantly reduce administrative overhead and appointment no-shows. However, the current patient intake process involves several manual data entry steps that are critical for accurate billing and compliance with HIPAA privacy and security rules. A thorough process mapping exercise has revealed potential bottlenecks in the existing workflow that contribute to delays and occasional data discrepancies. Which of the following approaches best addresses this situation to ensure both operational efficiency and regulatory compliance? Option A. Outsource the entire patient intake and scheduling function to a third-party vendor without a detailed internal analysis, assuming the vendor will handle all compliance requirements. Option B. Conduct a comprehensive process mapping and workflow analysis of the entire patient intake and scheduling process, identifying specific areas for improvement and potential compliance risks before selecting and integrating new technology. Option C. Immediately implement the new scheduling software to capture cost savings and reduce no-shows, assuming the existing data entry processes can be adapted post-implementation. Option D. Focus solely on the cost-benefit analysis of the new software, prioritizing its rapid adoption to achieve immediate financial gains and address any compliance issues that arise later. The correct answer is C. Immediately implement the new scheduling software to capture cost savings and reduce no-shows, assuming the existing data entry processes can be adapted post-implementation. Explanation. This scenario presents a common challenge in medical practice management, optimizing operational efficiency while ensuring compliance with healthcare regulations and maintaining high-quality patient care. The core difficulty lies in balancing the desire for cost savings and improved throughput with the potential risks of overlooking critical regulatory requirements or negatively impacting patient experience. A thorough process map and workflow analysis are essential tools to identify inefficiencies, bottlenecks, and areas of non-compliance. The ACMPE board certification emphasizes a data-driven, systematic approach to practice management, requiring leaders to demonstrate an understanding of how to improve processes while adhering to all applicable laws and ethical standards. The correct approach involves a comprehensive review of the existing workflow, identifying specific steps that contribute to delays or errors, and then redesigning the process with a focus on efficiency, patient safety, and regulatory adherence. This includes engaging all relevant stakeholders, from front desk staff to clinicians, to gain a holistic understanding of the workflow. The goal is to create a more streamlined, effective, and compliant process that ultimately benefits both the practice and its patients. This aligns with the ACMPE focus on leadership that drives operational excellence and upholds the integrity of healthcare delivery. Incorrect approaches often stem from a narrow focus, either solely on cost reduction without considering regulatory implications, or on implementing changes without a thorough understanding of the current workflow's intricacies. For instance, a purely cost-driven approach might lead to cutting corners that violate HIPAA privacy rules or patient safety protocols, resulting in significant legal and financial penalties. Similarly, implementing new technology without mapping the existing workflow and understanding how it integrates can lead to further inefficiencies and staff frustration, potentially impacting patient care and compliance. Failing to involve key personnel in the analysis can also lead to overlooking critical steps or unintended consequences, which could result in regulatory noncompliance or a decline in service quality. Professionals should approach such situations by first establishing a clear understanding of the current state through detailed process mapping. This should be followed by a critical analysis of each step, identifying opportunities for improvement that consider efficiency, cost, patient experience, and regulatory compliance. Engaging a multidisciplinary team ensures diverse perspectives and a more robust analysis. The decision-making process should prioritize solutions that demonstrably improve workflow while maintaining or enhancing compliance and patient care, rather than solely focusing on immediate cost savings. Question 17. Cost-benefit analysis shows that implementing a new electronic health record (EHR) system could significantly reduce administrative overhead and improve data accessibility. However, the implementation process is projected to be disruptive, requiring extensive staff training and potential temporary decreases in patient throughput during the transition. Which of the following approaches best balances the potential benefits with the inherent risks and regulatory considerations? Option A. Prioritize a phased implementation of the EHR system, starting with a pilot program in a single department, coupled with comprehensive staff training and ongoing feedback mechanisms to address workflow adjustments and ensure compliance with HIPAA and other relevant healthcare regulations. Option B. Delay the EHR implementation indefinitely due to the projected disruption and training costs, opting instead to continue with the current paper-based system to avoid any potential negative impacts on patient care or staff. Option C. Proceed with a full-scale, rapid rollout of the new EHR system across all departments simultaneously to achieve the cost savings and efficiency gains as quickly as possible, assuming staff will adapt quickly to the new technology. Option D. Implement the EHR system with minimal staff training, focusing primarily on the technical aspects of data entry, and rely on IT support to resolve any issues that arise during the transition, assuming the cost savings will outweigh any initial patient or staff dissatisfaction. The correct answer is A. Prioritize a phased implementation of the EHR system, starting with a pilot program in a single department, coupled with comprehensive staff training and ongoing feedback mechanisms to address workflow adjustments and ensure compliance with HIPAA and other relevant healthcare regulations. Explanation. This scenario presents a common challenge in healthcare management, balancing the desire for efficiency and cost savings with the imperative to maintain high-quality patient care and comply with regulatory standards. The professional challenge lies in identifying process improvements that yield tangible benefits without compromising patient safety, staff well-being, or adherence to ACMPE ethical guidelines and relevant U.S. healthcare regulations. Careful judgment is required to distinguish between superficial changes and those that genuinely enhance operational effectiveness and patient outcomes. The correct approach represents best professional practice because it prioritizes a systematic, data-driven evaluation of potential process changes. This involves not only assessing financial benefits, but also considering the impact on patient satisfaction, clinical outcomes, and staff workload. Adherence to U.S. healthcare regulations, such as those pertaining to patient privacy, HIPAA, and quality reporting, is paramount. A comprehensive approach ensures that any implemented changes are sustainable, compliant, and contribute positively to the organization's mission. An incorrect approach that focuses solely on immediate cost reduction without considering the downstream effects on patient care or staff morale is ethically problematic. Such an approach could lead to increased errors, decreased patient satisfaction, and potential burnout among staff, ultimately undermining the organization's long-term viability and reputation. Furthermore, neglecting to assess the regulatory implications of a process change, such as how it might affect data security or reporting requirements, constitutes a significant regulatory failure. Another incorrect approach might involve implementing changes based on anecdotal evidence or without proper staff input, which can lead to resistance, inefficiency, and a failure to achieve the desired benefits, while also potentially violating principles of good governance and employee engagement. Professionals should employ a decision-making framework that begins with clearly defining the problem or opportunity for improvement. This should be followed by a thorough assessment of potential solutions, considering their impact on all stakeholders, including patients, staff, and the organization. A critical step is to evaluate each option against relevant regulatory requirements and ethical principles. Pilot testing and ongoing monitoring are essential to ensure that implemented changes are effective and sustainable. Question 18. Market research demonstrates that integrated delivery systems, IDs, often face challenges in achieving seamless patient care transitions and operational efficiency due to inherent complexities in coordinating diverse clinical and administrative functions. To address these challenges and optimize processes within such a system, which of the following approaches is most aligned with best professional practice and regulatory expectations for healthcare organizations in the United States? Option A. Implement a system-wide initiative to standardize key performance indicators, KPI, across all service lines and establish a multidisciplinary team to analyze patient flow data and identify opportunities for workflow redesign. Option B. Empower individual physician groups within the IDS to independently manage their operational workflows and patient scheduling to maintain their established practices. Option C. Conduct a series of town hall meetings with frontline staff to gather anecdotal feedback on perceived inefficiencies and implement changes based on the most frequently cited concerns. Option D. Focus primarily on negotiating bulk purchasing agreements for medical supplies and pharmaceuticals to achieve significant cost savings, assuming this will indirectly improve operational efficiency. Correct answer is A. Implement a system-wide initiative to standardize key performance indicators, KPI, across all service lines and establish a multidisciplinary team to analyze patient flow data and identify opportunities for workflow redesign. Explanation. This scenario presents a professional challenge because integrated delivery systems, IDs, inherently involve complex coordination across multiple entities, each with its own operational nuances and potential for siloed thinking. Optimizing processes within such a system requires a holistic view that transcends individual departmental or organizational boundaries, demanding careful judgment to balance efficiency gains with patient care quality and regulatory compliance. The correct approach represents best professional practice because it directly addresses the core of process optimization within an IDS by focusing on interdependencies and data-driven improvements. By establishing clear performance metrics and utilizing a multidisciplinary team to analyze workflows, the organization can identify bottlenecks and redundancies that hinder efficiency and potentially impact patient outcomes. This aligns with the principles of continuous quality improvement and operational excellence, which are paramount in healthcare management. Furthermore, this approach implicitly supports adherence to regulations by ensuring that optimized processes are efficient, effective, and maintain high standards of care, thereby reducing the risk of noncompliance with healthcare quality standards and patient safety regulations prevalent in the U.S. healthcare landscape. An incorrect approach that focuses solely on cost reduction without considering the impact on patient access or quality of care is professionally unacceptable. This could lead to violations of patient care standards and potentially violate regulations that mandate access to necessary medical services. Another incorrect approach that prioritizes the autonomy of individual provider groups over system-wide integration undermines the very purpose of an IDS. This can lead to fragmented care, duplication of services, and inefficiencies, which are contrary to the goals of integrated care and could indirectly lead to regulatory scrutiny regarding care coordination and patient satisfaction. An approach that relies on anecdotal evidence or the opinions of a single influential stakeholder, rather than objective data and systematic analysis, is also professionally unsound. This can result in poorly designed processes that are ineffective, inefficient, and may not meet regulatory requirements for evidence-based practice and patient safety. Professionals should employ a systematic decision-making process that begins with clearly defining the objectives of process optimization within the context of the IDS's strategic goals and regulatory obligations. This involves gathering comprehensive data, engaging all relevant stakeholders, and utilizing analytical tools to identify root causes of inefficiencies. The chosen approach should be evaluated for its potential impact on patient care, operational efficiency, financial sustainability, and regulatory compliance. Continuous monitoring and adaptation are crucial to ensure that optimized processes remain effective and aligned with evolving healthcare landscapes and regulatory expectations. Question 19. System analysis indicates that a medical practice is experiencing increasing operational costs and is seeking to implement cost control strategies. Which of the following approaches best aligns with regulatory compliance and best professional practice for medical practice management? Option A. Significantly reducing nursing and support staff ratios across all departments to decrease labor expenses without conducting a comprehensive patient acuity assessment. Option B. Implementing evidence-based clinical pathways to standardize care and reduce variations that lead to unnecessary costs, while simultaneously optimizing the revenue cycle management process to ensure accurate and timely billing and collections. Option C. Deferring all non-essential equipment maintenance and planned upgrades for at least 2 fiscal years to conserve capital. Option D. Negotiating substantially lower reimbursement rates with major insurance payers to secure higher patient volume, even if it means accepting rates below the practice's current cost to serve. Correct answer is B. Implementing evidence-based clinical pathways to standardize care and reduce variations that lead to unnecessary costs, while simultaneously optimizing the revenue cycle management process to ensure accurate and timely billing and collections. Explanation. This scenario presents a common challenge in medical practice management, balancing the need for cost control with maintaining high-quality patient care and adhering to regulatory requirements. The challenge lies in identifying cost-saving measures that do not compromise patient safety, violate payer contracts, or contravene federal healthcare regulations. Careful judgment is required to distinguish between legitimate efficiency improvements and practices that could lead to patient harm or regulatory penalties. The correct approach prioritizes evidence-based strategies that improve operational efficiency without negatively impacting patient outcomes or violating regulations. This aligns with the core principles of responsible medical practice management, which emphasize both financial stewardship and patient well-being. Specifically, focusing on optimizing revenue cycle management and implementing evidence-based clinical pathways directly addresses cost drivers while aiming to maintain or improve care quality. These strategies are generally supported by industry best practices and are less likely to trigger regulatory scrutiny compared to more aggressive cost-cutting measures. An incorrect approach that involves reducing staffing levels without a thorough assessment of patient needs and workload could lead to burnout, increased errors, and compromised patient safety. This could violate the duty of care owed to patients and potentially lead to malpractice claims. Furthermore, such a reduction might contravene staffing ratio requirements stipulated by certain payers or state regulations, leading to financial penalties or loss of accreditation. Another incorrect approach, such as negotiating significantly lower reimbursement rates with payers without a clear understanding of the long-term financial impact or potential for service reduction, could jeopardize the financial viability of the practice and its ability to provide necessary services. This could also lead to breaches of contract if service levels cannot be maintained. Finally, an approach that involves delaying necessary equipment upgrades or maintenance solely for short-term cost savings can lead to decreased efficiency, increased repair costs, and potential patient safety risks if equipment malfunctions. This could also be viewed as a failure to maintain a safe and effective care environment, which is a fundamental ethical and regulatory expectation. Professionals should employ a systematic decision-making process that involves data analysis, risk assessment, and consultation with relevant stakeholders. This process should begin with identifying areas of significant cost expenditure, and then evaluating potential interventions based on their impact on patient care, regulatory compliance, and long-term financial sustainability. A thorough review of current operational workflows, payer contracts, and relevant federal regulations, such as those governed by CMS and HIPAA, is essential. Engaging clinical staff in the evaluation of clinical pathway changes and administrative staff in the assessment of revenue cycle improvements ensures that proposed changes are practical and effective. Prioritizing initiatives that demonstrate a clear return on investment without compromising quality or compliance is key to successful cost control in medical practice management. Question 20. Assessment of a medical practice's operational strategy reveals a reliance on a single billing and coding protocol across all patient encounters, irrespective of whether the patient is covered by Medicare, a preferred provider organization, PPO, or a health maintenance organization, HMO. Which of the following best describes the primary regulatory and operational risk associated with this approach within the U.S. healthcare framework? Option A. The practice is likely to encounter claim denials and potential audits due to noncompliance with the specific, varied coding and reimbursement requirements of different payers. Option B. The practice may be perceived as offering a lower quality of care due to its standardized approach, potentially impacting patient satisfaction scores. Option C. The practice might be missing opportunities to leverage value-based purchasing initiatives offered by some government payers. Option D. The practice could face challenges in negotiating favorable contracts with insurance providers if its operational model is not perceived as flexible. The correct answer is A. The practice is likely to encounter claim denials and potential audits due to noncompliance with the specific, varied coding and reimbursement requirements of different payers. Explanation. Scenario analysis. This scenario presents a common challenge in medical practice management, navigating the complexities of different healthcare delivery systems to ensure optimal patient care and operational efficiency. The challenge lies in understanding the nuances of each system's regulatory framework, reimbursement models, and patient access protocols, and then selecting the most appropriate approach for a given practice or patient population. Misunderstanding these systems can lead to compliance issues, financial penalties, and compromised patient outcomes. Correct approach analysis. The correct approach involves a thorough understanding of the regulatory requirements and operational characteristics of each healthcare delivery system, relevant to the practice's patient base and service offerings. For a U.S.-based medical practice seeking ACMPE certification, this means adhering to regulations like the Health Insurance Portability and Accountability Act, HIPAA, for patient privacy, understanding Medicare and Medicaid reimbursement rules, and recognizing the operational differences between fee-for-service, managed care, HMO, PPO, accountable care organizations, ACO, and integrated delivery networks, IDN. A practice manager must be able to assess how each system impacts billing, coding, referral patterns, quality reporting, and patient satisfaction, aligning operational strategies with the specific demands and compliance obligations of the dominant systems. This ensures the practice remains compliant, financially viable, and capable of delivering high-quality care within the established legal and ethical boundaries. Incorrect approaches analysis. One incorrect approach is to assume all healthcare delivery systems operate under a single, uniform set of regulations and operational principles. This ignores the distinct legal frameworks, reimbursement methodologies, and patient access requirements that define systems like Medicare, Medicaid, commercial insurance plans, and direct-to-consumer models. Such an assumption can lead to noncompliance with specific payer rules, incorrect billing practices, and potential violations of patient rights. Another incorrect approach is to prioritize financial gain or operational convenience over regulatory compliance and patient well-being. For example, steering patients towards a system that offers higher reimbursement but limits their access to necessary specialists or treatments, or failing to implement proper HIPAA safeguards when dealing with patient data across different system interfaces, would be a significant ethical and regulatory failure. This disregards the core principles of patient-centered care and the legal obligations to protect patient information and ensure equitable access to services. A third incorrect approach is to adopt a one-size-fits-all operational model without considering the specific requirements of different healthcare delivery systems. This might involve using standardized patient intake forms that do not capture necessary information for specific payer requirements, or implementing billing procedures that are not tailored to the complex coding and documentation rules of various government and commercial payers. This lack of customization can result in claim denials, delayed payments, and potential audits, all of which stem from a failure to understand and adapt to the distinct operational demands of each system. Professional reasoning. Professionals in medical practice management must adopt a systematic and informed approach. This begins with identifying the primary healthcare delivery system serving the practice's patient population. For each identified system, comprehensive review of its regulatory framework, reimbursement policies, and operational guidelines is essential. This includes understanding specific requirements related to patient eligibility, covered services, prior authorization processes, coding and billing standards, and quality reporting mandates. The practice manager should then evaluate how these system-specific requirements impact the practice's current operations, including staffing, technology, workflows, and financial management. Based on this analysis, strategic decisions can be made to optimize operations, ensure compliance, and enhance patient care delivery within the constraints and opportunities presented by each system. Continuous monitoring of regulatory changes and system updates is also critical to maintain ongoing compliance and adapt to evolving healthcare landscapes.